we were considering a program in Connecticut very highly, and he was like, "Oh boy, if we can live like the Gilmore Girls, I'd be down for that." And I was like, "I really don't think every city in
Real life, I
Connecticut is
wish.
like Stars Hollows."
Welcome back to this week's episode of Surgeon Interrupted. I'm Frances May Harden, your host, and I'm so excited this week to be joined by Dr. Christina Huang. Remember to check out all of our shows and content at hippocratic-collective.com. Today's episode is brought to you by the Hippocratic Collective. And I can't wait to introduce our incredible guest. Christina is a chief resident in radiation oncology, now finishing up residency in the Southeast. She's passionate about medical education, especially promoting a healthy workplace culture in residency and fostering safe learning environments. She will be a general radiation oncologist with specialization in genitourinary and gynecologic malignancies. She also specializes in brachytherapy, a procedure where catheters are placed into tumors to dwell sealed radiation sources in the OR setting. Christina, thank you so much for being here today.
Thank you for having me. I'm very excited.
All right. And, we had the privilege of hanging out together at our Philly event for HC. So it's great that, that was just the best time. That's for another time and place. But what's great is that so many physicians got to connect with like-minded people. And I know you mentioned that our paths have crossed probably inadvertently multiple times, having both come up in the Midwest. We both spent time in Indiana, and we both married men who inexplicably like Paris Geller.
Green flag men. My husband's gonna be so mad that I talked about him. He's very shy, so.
Yeah, he might be like, I didn't want my coworkers to know about my Stars Hollow fandom. Here's what I love too, because maybe we need to ask your husband who his second favorite character is, because I will say that Collins is Emily. So
Oh,
if you
Emily
like
Gilmore.
Paris and Emily Gilmore, green flags.
Green flag. Yeah, maybe my red flag is I haven't finished the Gilmore Girls yet.
You haven't
I
seen A
know.
Year in the Life?
I haven't. I started watching it way later. I guess that's also a weird trait of mine. So we listened to your episode on the Gervais principle,
Yeah.
and I had never seen The Office all at once, just in random bits. And so we've been binge watching, now it's early Office, but I don't even know what happens really. So
But
I've been
that'd be so fun. Is it fun?
experiencing it. It's so fun. It makes so much sense, the principle, and also Steve's been loving it, and he keeps giggling so much when we watch it. I'm like, I didn't know you loved The Office this much.
No, that's so fun. And I'm like you. I didn't watch Gilmore Girls really until kind of late college and beyond. I didn't grow up watching it. I missed it when it was live, but it's been really a joy to watch since then. And I do think that not that I'm dating or asking guys this, but if they were oh, I'm a Rory super fan, I do not think that they would like me.
They
Kind
want
of.
the demure, the rule follower, which is nothing wrong with that. I'm also a rule follower, but I'm not very demure.
But I was going to say we're not demure. I feel like you and I get stuff done.
Yeah,
Parentheses,
practical.
complimentary. Yeah, very effective people. So yeah, we're such Parises. I love it.
Yeah, very high anxiety. At least I do.
Yeah. No, absolutely. And so, of course, I'm so excited to dive in today with you. And really, what we want to bring to all of y'all today is just within the framework of looking at the career in medicine from our perspectives, which would be younger millennial women, looking at it over all of the stages and phases of the career, right? So we're going all the way back to talk about undergrad, med school, residency, and then attending life. And so really we're looking at medical education as the whole arc in a way where, what defines each stage? What can we learn from each stage? And, I love the holistic approach that you wanted to take here. So we're going to do that.
All right, I'm excited.
Let's even rewind to the point of high school. So for so many physicians, this is where the idea of medicine or I'm going to become a doctor really enters the picture. picture solidly. So when you look back, what was high school like for you? Were things percolating? What was your early stage entry into medicine?
Yeah, my journey into medicine was kind of slow, to be honest. Like, for the longest time, I was like, yeah, I think I'm going to be not a doctor, not even anything in medicine. I wanted to be like an advertising director. I think because I watched that movie,
Ooh.
What Women Want, and I was
Oh,
like,
and
oh,
like
that
Devil
dude
Wears
has a,
Prada?
yeah, or like that. But obviously, that job is tough too in a lot of different ways. But I think like slowly over the course of high school, I was always a very fearful child. Like I was very shy, didn't want to like break any of the rules. My parents were also immigrants, so I had to like I don't know, I felt a lot of like responsibility on my shoulders at all times. Who knows how much responsibility I actually had, but my parents like they are good at English, but like, there's this level of cultural translation that you have to do when you're the eldest daughter of an immigrant family. But I think, like, slowly I found my, like, footing and, like, a lot of, like, seeking out colleges was thinking pre-med. I don't know where I found my confidence, but I was like, "Okay, I'm gonna go to college and try this pre-med thing out," and pretty much at every stage of my life, it's just been like, "Oh, who knows if I could do it?" But, I'm fearful, but I'm gonna do everything I can to, like, optimize. Optimizing was always, like, a big part of this, and I think a lot of doctors feel this way. And so, like, I try to do everything in my control to, like, optimize, and then I guess I made it eventually, so
Oh, I love that. No, but so many relatable things. Like, I truly, when you even talk about, yes, you sometimes felt fearful. That reminds me of one of my favorite quotes, which is sometimes the fear does not subside and you have to do it afraid. Absolutely. Happens to all of us. But I almost feel like you were doing lucky girl syndrome before they called it lucky girl syndrome. That's like what kids would call it these days. But,
Oh,
when you
I
talk
didn't even
about,
know what that is.
you haven't heard of it?
No.
Oh my gosh. Well, don't feel bad.
I'm
The kids keep
uncultured.
me young. I try to stay out in these streets. I'm just kidding. I go to bed at like 8:30 p.m., so I'm not out in the streets. But lucky girl syndrome, this is a social media trend that promotes the idea that believing you are lucky can attract positive outcomes and opportunity into
Oh.
your life. So the
You
reason that it
manifested.
exactly like manifested, but also I do believe that, and this is some of my own spin and interpretation on it, but this concept of like you give yourself opportunities to be in the right place at the right time. And like if we do legitimately lock ourselves away and never talk to anyone for 100 consecutive days, like I don't know how opportunity is going to find you, right, in those
I see.
circumstances. But when you talk about optimizing, you do talk about like, I mean, regardless of how fearful or not you felt, you did put yourself out there in many ways, right? Like, okay, well, there's no guarantees in life. That's a pretty Zen philosophy and approach, but like I will put myself out there in these ways.
Yeah, and I
And
think, like, nothing sorry to interrupt, nothing ever felt like, like I was owed, like, to be a doctor, and that's probably just part of, like my parents didn't know anything about medicine. Like, I have, like, a cousin who is in medicine, but he's, like, 15 years older than me, like, he's more like an uncle, and he was like, "Don't do medicine if you can see yourself doing anything else, Christina," and I was like,
yeah.
"No, I wanna be a doctor." I don't know, like, stubborn.
So were your parents supportive then?
They were supportive, but interestingly enough, they didn't follow the trope of, like, Asian parents, and if anything, my dad was like, "It's kind of a long road. Are you sure?" And I was just like, "Yes, I'm sure." I'm so like, at the same time, while I was, like, not confident in myself, I was, like, confident of, like, what I liked and what I wanted, like, very far down the road, so, like, I think it felt nice to know that it was my choice, and that is, like, a luxury that not a lot of people have, to be honest. It's just like, you have to be a doctor, whatever your family situation is. And so I feel very lucky to have had that.
No, I love that. And it makes sense. I didn't know that you were an eldest daughter until now, but makes perfect sense. I think
Are
that
you as
that
oh, you're an only child.
I'm an only
My
child.
husband's also an only child, so
Ooh.
yeah. But he's not your typical, I don't know what your typical only child is, but
I mean, I feel like it's okay. I can say it. Like, since I'm an only child, like the typical only child is petulant and, you know, a myriad of other they're, like, not well socialized, or we don't get
yeah.
socialized maybe, like, the normal way. So, if you were a really popular only child, obviously, kudos to you, and you may have gotten socialized okay. I, don't have any chip on my shoulder about the fact that I did not quite get socialized normally, and that has played out, interestingly over my adult life. And I'm trying to socialize myself now. I'm late to the game, but like we can always learn new stuff even when we're older.
You seem pretty well socialized to me. You always say that. Yeah, I hear you say that on previous episodes. You're like, I wasn't socialized correctly, but also I was pretty weird as a kid too. I was like super nerdy, like never felt like I fit in. I was part of this like nerd clique in high school. Like high school was not fun, mostly because I feel like I made it unfun for myself because I felt like I didn't fit in, you
Yeah,
know.
no, absolutely. I think that that's so true. Tina Fey actually has a hilarious skit about this in 30 Rock where basically she just talks a lot to Jack Donaghy, Alec Baldwin. She's like, kids were like so mean to me in high
Oh my
school.
god, I
Like it
know
was
this skit.
awful. Yeah. She's like,
Yes.
it was awful. Like I'm gonna go back to my high school reunion and show them like I actually made something of myself. Like I'm proud of where I've made it professionally. And oh man, they were just bullies. And she brings it back to the high school reunion, and literally she was the bully the whole
I know
time. They
she was
like
so
burst into
mean.
tears. Yeah, she was. Yeah, exactly. I thought that episode, it was very helpful to see like, oh, there could be like multiple different perspectives on this.
Yeah, definitely. Um, yeah, sorry. I guess not to jump to like I didn't quite answer your question on like how I chose medicine. This kind
Mm-hmm.
of crossed my mind.
Yeah.
But I did shadow like my pediatrician and she was like a very cool lady, and I was like, I want to be her. So I think it does like little sparks like that or inspirations or mentors or role models, like they're important and you like kind of forget them like throughout because you meet so many people throughout the way. So shout out to my
Yeah.
pediatrician.
I love that. That's really cool. And honestly, like shout out to my pediatrician because I loved her. She was just a badass and I liked her. I mean, I was afraid of shots. I would cry and cry. But like other than that, I did really like her and I liked her practice. She had a good team. So I guess that my question, moving on to like the undergrad years, you have kind of implied here in your younger years, high school, college, I would think in that era, you took things pretty seriously and you worked really hard. So I would love to hear how that played out specifically in undergrad, in pre-med. Like, what did that look like? Is there, I guess, and I want to get into and make sure we just touch on, did we enjoy the journey at all at the time? Maybe not. I had nose to grindstone. I would not say I enjoyed the journey at the time, but
Wait, before we move on to my college, can I ask you,
yeah.
because you graduated very early from high school, right?
Hmm.
And went to college.
Yep.
So what was that like for you?
Oh my gosh, you can't put me in the hot seat, Christina.
Sorry.
What the heck? No, I'm just kidding. No, I appreciate your question. Um, I think that this is what's so interesting too, and honestly, kind of like the Tina Fey thing, in the sense that I actually did not think it was weird at the time. I remember a lot of people asking me if it was weird and asking me like, "Hey, this seems pretty weird. Is it weird? Do you feel normal?" I remember all of that, and every time I was like, "Yeah, I feel totally normal. Like, is something weird happening?" And so I just think that kind of helps show people maybe where I was at the time, which was that I didn't even have enough frame of reference to say something weird is happening. Looking back, it was a blessing that I was already 6 foot, like I was 16 years old, but I was 6 feet tall. I did have a baby face, but I do think like even my classmates, my cohorts, because there were many of us at that age, leaving IMSA at 16, and like more petite women and things like that, they had a harder time probably. I just kind of looked like maybe an extra baby-faced, but taller stature person. And then if somebody had a conversation with me, then they were like, in addition to the baby face, I see that you are so extraordinarily weird, especially at Notre Dame, because I ended up happening to not go to a really nerdy school. Kind of a mistake. So I went to a school that maybe has like the fewest nerds per
I
capita.
know, so jock, like so full of jocks.
Yeah, pretty white as well.
Yeah.
So, I do think that um it was just an interesting time. I can tell you, fortunately, I did not notice the weirdness at the time, but it also led to probably like miscommunications or like missed connections of people being like, this person's too weird to function.
So did people tell you you were like a genius and like it's time to skip grades?
I skipped first grade and then freshman year.
Oh,
Those were the
wow.
two that I skipped. So first grade, yeah, it just was that they were like, this is going to be too boring for you, so we'll just like put this kid slightly up. I will say I attended Chinese school like first grade through 8th grade every
Oh,
Saturday.
wow.
And so, and not only did I do the Mandarin classes, but I also did math, obviously, like I think required there. So the math classes were always 2 grades above what we were doing at my Catholic school, in the Chicago suburbs.
I
So
think I also did that. They like put me in a more advanced math class, but to be honest, I wasn't that good at math. Like my friends were good at math, so then I think they lumped me in
no,
with
well,
those
no,
people.
that's just normal in Chinese school. I just feel like they're like, oh, how old are you? Like you're 8, we're gonna put you in 10-year-old, like the equivalent of white person's 10-year-old math. Like that's just kind of how they. So yeah, I was with my class there, um, and so interestingly, with the freshman year, yeah, it wasn't that I just had to skip a grade. It's that IMSA is a 3-year high school, so either you have
Oh,
2 options. You, the applicant, you can either graduate 8th grade and start, in which case you go from being an 8th grader to being a 10th grader, which
oh
is what I
wow.
did. Or you can go anywhere and do your freshman year, and then all the freshmen move in and they become sophomores at IMSA. Those are the 2 paths. I will say that the Schmen path, the freshman, sophomore Schmen path, like I took the SAT early on in 7th grade. I was like starting 7th grade and I took the SAT for my IMSA application. And
Oh my
then
gosh, yeah.
you have to take freshman year equivalent. So I was at a community college in town doing biology. I did psychology. I think a math. Like you just have to prove that you've already done the equivalents.
Wow. It is funny. I mean, it's not funny, but like how I feel like especially like I don't know, 20 years ago, they really loved tracking kids, like finding the little geniuses. And then, I also like took all these random tests and they're like, "Yes, we'll place you into this class or whatever." And I don't know if it was good in hindsight. Like it is what it is, but I think it would have been great to just be in the normal class. I don't know why like it was important for me to go up one level in math. Like I think I could have just learned math with most people. Yeah.
Totally. But I think that there's so much to unpack there because like what percentage of it is pressure that we put on ourselves back then? I would not, even with IMSA, people are like, well, did your parents make you go to a gifted school? And it's like, no, I fully remember them being like, hey, we found something really cool. Like, this is coming across your desk. I was like a middle schooler and I had a desk and they'd be like, this very interesting opportunity or project has come across your desk.
Yeah.
Would you
I would
like
have
to do
said
it?
yes.
Yeah. I was like, that's great. I didn't feel super appreciated in the Catholic school in my small town. Like, IMSA is the best thing that ever happened to me, I think, education and career wise.
That's awesome. Well, thanks for diving into that. I've just always wondered because I'm like, oh wow, she like skipped so many grades. Like, what's her savant secret?
Yeah, I think that there's it's always fun to consider we should do a project that's like how our child genius is doing now. And it's like in their 30s and they can't, like
Function.
cook a meal. Like I can't
Yeah,
like use the stove.
they're like, give me a Scantron, and I'll ace it.
Yeah, and I'll wow you with a Scantron. Hannah, our producer, is laughing because she may have not yet seen a Scantron. Like Jen, I mean, okay, she uses Scantrons, but I mean, I get it because Hannah, either way, is not that impressed, rightfully so, because like this goes back to everything I've been saying to you guys about like prestige and like I cannot walk into a room in this day and age and be like, y'all wouldn't even comprehend what I could do with a Scantron. They would be like, ugh. And I would be like, wow, that's so weird. Like, why doesn't anyone think I'm cool? And so we evolve or die, right, Christina?
A what?
Evolve or die.
Evolve or die? Wait, what's that from?
I've just been using it as a mantra. I don't know that it's from anything, but I do believe it. I do think about that a lot.
I like your quotes. That's like another thing from your podcast that I love.
That's
Sorry
so
to get all
nice. Thank
meta.
you. Oh my gosh. Well, so yeah, I would love to hear about kind of your undergrad years and again, like how you related to the work because you're giving us great insight into you chose this with your own agency, like you want to be here, but you are very committed. You're an eldest daughter. So what is that experience like?
Yeah. So I guess moving into college, so you went to a non-nerd school and I went to the nerdiest school possible, which is the University of Chicago, on the south side of Chicago. And wow, for the first time in my life, I felt cooler because I was amongst my fellow nerds. And I don't know, I became a lot more social because I don't know why, but I just felt really comfortable there. I was still really anxious, like the entire time the goal was get straight A's, which is not easy to do at University of Chicago. And I did not get straight A's. I had to be okay with B's, and I
Mhm.
survived. Here I am to tell the tale. You know, I think, like, the big, decision I had to make, and I think, like, a lot of people in medicine, they have, you know, each phase of their education, they have to make huge decisions, and it was, do I go to state school or do I go to University of Chicago? And there was a lot of finances kind of involved because, I mean, these private schools, they're expensive, you take on a lot of debt to go to them, but they offer you a lot of unique opportunities, and
Mhm.
I'm lucky that, ultimately my parents supported me, and I got more, like, financial aid than I thought I would, and then, yeah, I just had a really good time there, and to be honest, like, I did the pre-med path, which is
Mhm.
just majoring in biology because it covered the most pre-med classes, but my favorite classes were not the science classes at all. Like, it was the humanities classes, talking about all these random philosophers. And then, I kind of avoided pre med people in general, mostly because I didn't like comparing myself to them. Like, my parents like had done that way more than enough in childhood. They'd be like, "Oh, so and so is doing this. Why don't you do this?" And I don't know if that's like an immigrant kind of experience where your circle's not very big and you don't have a lot of resources. So all you have to go off of is, like, comparing your child to, like, your children's peers. But that was not healthy for me, and I hated that. Um, and yeah, I don't know. College was good, and then I got in med school, so that's my college life. It was a nerdy, good time.
I love that, and that reminds me of me in high school. Like, when I got to IMSA, I was I became the dumb jock of IMSA, like, and I was like, "Amazing," and I
You're the
feel like I
social
really,
butterfly.
yeah, came out of my shell, like, was comfortable to come out of my shell, suddenly very sociable, getting something other than extraordinarily negative cues from the external environment. Um, so I love that. That sounds so cool
Yeah.
that you had that experience at University of Chicago.
What was Notre Dame for you like then? Did you just get the pre-med or the med requirements and then hightail it out of there?
Yeah, I had a couple good friends, some of which I'm still friends with to this day. So, but I would say I just more like kept to myself. It was definitely like, so it was a step backwards from the outgoing, very sociable high school years. I think anyone who knew me in high school would have found me pretty extroverted. Same thing even with medical school and beyond, but just like at Notre Dame, it was kind of isolating. And I was so young, I didn't have like a lot of skills or techniques to just cope with like regular occurrences in the world. Like, no one, I think that part of what I'm doing now or attempting to do now is just literally explain things to people. Just be like, hey, this is part of life. Someone really might scream at you in a meeting. Like, until that had happened to me, no one warned me that it could happen. It definitely does happen. And especially because I'm just a super literal, kind of neurodivergent person, like, it helped a lot to actually have it explained and then really work through it with some of like the trusted people in my life now. But I just feel like if I could go back in time, I would have a lot to say to a 20-year-old, where I'd be like, I'm just going to explain this. That way it won't be like really shocking and disorienting when these things happen.
Yeah, but to be, and I heard this in your previous episodes, is just like having like a very compassionate view towards your younger self. Cause like, I mean, we were really like children, like in college, like we're just living away from our parents in like dorm rooms. And I think like, not to gloss over college, I mean, it was tough. Every day I'd be like, what essay do I have to write? I got to study for this test. Oh no, I got an 87 and not a 90 on this test. And it's like day in and day out. And then I had to balance, some people are going to the city on Saturday. Oh, I have to like say no because I've got this big OChem test coming up.
Mhm.
And you kind of just start, like the people who are destined to go to med school, they are the ones who are really neurotic and perfectionists, and they are trying to get straight A's like in all their classes. And sometimes those classes are really tough. And all you can do is literally study all week for those classes, and, I mean, those are the people who end up doing I learned this in college, was, like, you don't have to be smart, or, like, I always felt very stupid, like, for a long time, but then I realized the people who are doing really well on tests, like, they were just working really hard, but then they weren't, like, letting on that, like, the You're a duck on water and you're paddling furiously underneath, but you like just
Mhm.
gliding along. And I've discovered that secret in undergrad and was like, wait, like I just need to work a little bit harder and spend the time, do the questions, and then I'll do fine on the test. So I
I
know
love
this
that.
is a very boring topic, test taking, but I mean it's it's integral to med school, to residency. You take boards, and even as
Mhm.
attending, you take more boards.
Yeah.
Like you got to be good at tests if you want to get through the med school journey.
Yeah.
Unfortunately,
No, I love that. And I will say too that, we can always get better at test taking. Like I know tons of people who had real evolution in that area as they like continued throughout their career. But I definitely echo what you're saying about it's easy as a young person to just get so obsessed with even like a couple points on a test. I agree with you. It's tough because medicine self-selects for those type of people. Like honestly, the types of people to be like, well, a 92 isn't a 95. I feel good about this. I'm going to move on with my day. Guess what? That sounds like Colin. That sounds like my husband.
I know that's my husband
Yeah,
too.
see, like that's what
Type
and that
B. I'm type A. I'm like beating myself up. Why didn't you do XYZ? Totally not compassionate to myself, causing all this anxiety for no reason. I can't change the past. And then as I matured, then I realized, okay, like, yeah, it is what it is. The test is over.
yeah, exactly. So one, it's really nice. It's a gift to live with a type B person when you are like us. Like we've been together almost 9 years and it is like starting to rub off on me. Even if my knee jerk reaction is this is a catastrophe and I need to get that point back, my second immediate follow-up thought is, nah, this isn't a big deal. I'm going to
Yeah,
move on.
it's fine.
So incredible. Well, I'd love to hear about medical school now.
Yeah, med school. Well, I guess like one point I'll bring up,
Mhm.
and it relates to your idea of prestige. I mean, University of Chicago is very prestigious, and like that's cool and all. But then I became like obsessed with it. I just like I was like a child, like I was like, oh, this is the only thing that like, not that I'm like proud of, but like it gave me a lot of confidence that I like went to that college, and then like
Mhm.
I went to state school. I went to Indiana for medical school, and that's amazing, right? Like
Mhm.
most people don't even get into medical school. And I was having this conversation with my PI, the head of my lab, and she's like, "You know what, Christina, like it's awesome that you hit this milestone and you should just, be happy with it because there's always going to be, oh, I'm not going to be happy until I hit this next thing or this next thing, and you can just delay gratification forever." And like I don't know exactly what I'm trying to say, but like I think kind of along my journey is just learning to be grateful for every step of the way, right? Maybe the med school I went to wasn't my first choice, but then in the end I was so happy. I would not have picked any other path, but you don't learn that until you finish all 4 years. You're like, I've met some of the greatest people I've ever met. I've been humbled. The people around me have made me so much better. And so med school is a really good time for me. And if anything, after my nerd school experience, like, not to be like that person, but med school felt a lot less stressful because it was like finally, I feel like the facts that I was learning, the things that I was learning, they felt so tangible.
Mhm.
But I will tell a story, and it's kind of embarrassing, but it's related to TV. There's this moment where I was studying for step one, and now it's different because step one is pass fail, but step two is scored. So all
Mhm.
the onus is on step two, but still, it's like step one back when it was scored was like the gateway to whatever specialty, right? Like
Yeah.
if you score too low
Yeah.
on it, you cannot go to certain specialties. And so I was trying to keep my morale up because, again, I was driven by fear, and I was like, I just need to get a good enough step score to be able to do surgery. I was actually wanting to do surgery
Oh
or
my
bus.
gosh.
Yeah, I was like a surgery or bus kind of person. And I was like losing all morale. My med school roommate was really frustrated with me because I had this rule with her. I was like, "We cannot talk about STEP. That's the rule in this house."
Oh my
Or like, "We can
gosh.
vaguely talk about STEP, but do not tell me scores. Do not tell me anything. Otherwise, I'll freak out on you, and I don't want that to taint our relationship." And in hindsight, that was really smart of me because we're like best friends. Like we had a good time as roommates. And then, sorry, this is like such a long story, but I was like losing all morale that I started watching Grey's Anatomy, which I'd never seen before because I don't know, maybe it's like being an immigrant child of immigrants. I had missed all the pop culture, but then I
Mhm.
was like, "Oh, what is it like to be a doctor?" Obviously, it's not like Grey's Anatomy, but I was like, I just wanted to see people be a doctor. And
Mhm.
that, like, motivated me a little bit more through step 1, and then I took the test, then it was over, so then
I
my life
love
went back
that.
to normal.
I definitely had, like, a TV show. I think when I was doing maybe it was step 2, but Unbreakable Kimmy Schmidt was out. Like, I had, like, such a strict, super, super strict study schedule for those dedicated weeks, but, like, I had a workout over the lunch break, and then at, like, 5:30 PM every night, I got to watch 1 episode of Unbreakable Kimmy Schmidt, and then I'd, review my notes for the day and then kind of wind down. So, no, I'm very pro TV. I'm pro screen time, pro TVs, and so I love the way that, like, helped get you over the finish line.
Yeah, and then I would also watch sports documentaries because 'cause I'm not sporty at all, like, I played tennis, like, recreationally and very poorly, but something about athletes just pushing through despite the
Mhm.
pain and monotony, and just to get those extra reps, for some reason, that really motivated me too. Because it is, like, when you're studying for these tests over weeks, months, you're saying no to lots of social events, and people don't understand, like, I actually met my husband during step 1 studying time. That's how I know he's a keeper, because he
Oh.
watched me at, like, the height of my anxiety, and stress, and he stayed.
How'd
Yeah.
you guys meet?
We met over Bumble, just like all of the HC
It's the same as us.
people. I
Wow,
know.
I love that.
I know.
Bumble, call us.
Yeah, call us, sponsor us.
That's amazing. And yes, agreed that he's a keeper and, it honestly, I mean, I think that a relationship after going through some of the most brutal times in medicine, other things are like kind of a breeze. Like regular couples don't have to go through much that's quite as stressful as some of these really trying times.
Yeah.
Um, I guess my question is, before we even move into residency, I just want to hear about if you think that there were things done correctly that promoted a safe learning environment as a medical student. And because again, we're going to talk about this a bit in residency before we wrap up.
Yeah, that's a good question because, to be honest, after my clinical year, and that's the 3rd year, I mean, I was exhausted. I was really burnt out, and, like, what is burnout even? I think it's being so tired you can't even function in your job and learn. Um, and it was really, it was really tough, and I thought I'd wanted to do surgery, but
Mhm.
then I experienced what inpatient is like, my very first, like, rotation. I was like, "What do you mean we only get 4 days off this month?" Like, they're like, "Yeah, that's normal." I was like, "This is crazy." And then I experienced an outpatient month right after that. I was like, "I'm doing an outpatient specialty." Um, and, you go through all these different rotations and you see the different learning environments, the different cultures of all the different specialties, and then you figure out who are your people. I had a good surgery experience, actually general surgery experience, and that's originally what I wanted to do, and then specialize in surgical oncology, like Atul Gawande, who I love
Mhm.
his book.
Mhm.
Um, and yeah, there's a story where I was getting along with everyone great. There's a scrub nurse who I really enjoyed talking to, like, who's super nice to me, got out my size gloves every time for the case. So nice. And
Mhm.
then I watched a surgeon who is actually a really great teacher, like very nice to medical students, just scream basically at the scrub nurse for opening up like the wrong whatever. And they're like, that's 100 something dollars, $200, and like, said a bunch of horrible things to them. And I was just like, okay, I'm out of here. Like, if this training environment fosters that, like, no, I'm going to choose a different crew to hang with. So my desire to be in surgery kind of ended after
Vibes
that.
are off. Yeah.
Super
Wow.
off.
I mean, but I applaud you because I mean, that's ultimately like why I left. And it just took me like a lot longer. I mean, once you're in deeper, it takes more time to
Yeah,
figure out how
it's
to get
hard to
out
get
from
out.
a quicksand standpoint. But yeah, but I will say that here's where we differentiate and why I was a clown in many regards. When I was a medical student, and I did well in medical school, like I killed my rotations, I was AOA, I did well. If I saw stuff like that happen, because I still have my memories from back then. Like, I'm not that old. It was a mix of, number one, an ego problem with, number two, lack of context for things happening. Because, like, it is true that as a medical student, often you don't know why somebody is screaming. Like, if somebody's screaming because, like, they're like, you idiot, like, how did you not see that nerve in that fascial plane? I don't know what that person's expected to know, because I don't know where the nerve is and I don't know what fascial plane that is. Like, I mean, you don't have like context, so it's actually sometimes hard to know if it's like justified yelling. And I put that in quotes because obviously now I feel very differently about it than I did 10 years ago. 10 years ago, I'd be like, yeah, that's maybe true. They're being yelled at because they're an idiot. That lady opened something that's over $100 worth of value. That's just, when I say that that's like asshole behavior, I don't exempt myself from that. Like, I just used to buy into that ethos.
You were
And
like
like,
assimilating into that culture as hard as you could because that's what you wanted. You're like, I want to be that surgeon. So I'm going to just, everything they do is normal. And that's.
exactly. And like, I was raised to an extent. I mean, I grew up in this environment that's like, winners win. And I didn't come here to make friends. So, like, sure, screaming is on the table, especially if somebody deserves it. But this really has been like such a crazy journey because, one, I really, now I don't really think it's, I can count on one hand the number of times where it's like merited, and that screaming is never even like personal. Like, how could you do that? Blah, blah, blah. It's just more like, this person's dying in an airway emergency. I asked for an 11 blade. I'm going to keep more loudly asking for an 11 blade. Fine. That's not even like personal shots at people. But yeah, I think that that's so interesting. And it sounds like I just applaud you, because a person who at a young age, like that, you're describing medical school, clinical rotations, let's say that you're an M3, and you see that and you just think, okay, this doesn't align with my values. I know who I am. I know what my values are. This doesn't align with those values. No worries at all. I'm going to go find something that aligns. That is just a level of like self-knowledge and maturity that not everybody has at that stage.
Yeah, I think I don't even know why I was so I guess I was just like, I've got this huge decision coming up, and so day in and day out I was like, is this the right decision? Is this the right decision? And I did doubt myself a lot, which was actually good in hindsight. I didn't take anything for granted or like, oh, of course, it's this way. And I think maybe that helped as well, cuz I think like once I realized I could choose a different specialty other than surgery, that kind of really opened up the realm of possibilities. Because I think there was like an alternative world where I just was like, no, it's surgery. I gotta grit harder if I want to
Mm-hmm.
do that. Because like I really do love like the OR.
Mm-hmm.
But then once I realized that there were other ways to get into the OR, I was like, okay, I'm gonna explore those pathways.
Yeah, and that brings us to, I want to finish off on residency. And I was going to say, like, you did find another way to be a proceduralist and be in the OR.
Yeah. So, how did I find Radonc? That's always like a very fun question to ask any Radonc
Mm-hmm.
because it's a tiny little field. I would say like 190-ish people go into it every year. And, radiation oncology is where you use radiation to treat tumors, typically. And then, typically we're curing tumors or giving treatment adjuvantly to like as part of a curative treatment paradigm, or we can palliate tumors.
Mm-hmm.
And then I do something called brachytherapy, which you explained earlier, and it's typically used for gynecologic and genitourinary cancers. And so that's an OR procedure. The way I found it was, and I didn't say this on my interviews because Instagram was way less like prevalent back then,
Oh,
but I literally had like a identity crisis. I was like, I can't be a surgeon. Inpatients is like so difficult for me. I don't like only having 4 days off. And
yeah.
I like the outpatient setting. And so I kind of like explore. I was like, what is the difference between interventional radiology, diagnostic radiology, and radiation oncology? I didn't even know. I was like a
Mm-hmm.
fresh third year. And I just DM'd a random radiation oncology resident on Instagram. She very kindly, like this was pre-ChatGPT, wrote paragraphs about
Wow.
her experience and explained the difference to me, even though it's like so obvious in hindsight. But, every time I met someone in radiation oncology, they were so eager to tell me like, about it. They never, like, judged me for not knowing anything. I think
Mhm.
as radiation oncologists, we're used to no one knowing our specialty, and I think we're like natural teachers. When I meet a patient, they know nothing about radiation. They're like, "Am I gonna be
Mhm.
radioactive?" And I'm like, in most cases, no. And, like, it's very safe and, like, it's not what you're imagining. And so I, like, reteach it every time, and I don't know, I was like, "These are my people, they're very kind," and their patients love them, they form wonderful longitudinal relationships, and, in the back of my mind, I was like, "And there's a procedural aspect that I can pursue, if I want to." And on one of my rotations, it was my anesthesiology rotation, actually. I got this huge pep talk by one of the anesthesiologists who was just like, "You know what? Procedures are just like, it's kinda like driving a car. After you do
Mhm.
the 100th one, your mind shuts off, it's not even fun anymore." So he was, like, giving us this whole pep talk on, choosing a specialty in medicine. Yeah, you want it to be something that you're interested in, that does, spark some intellectual curiosity, but at some point in your career, it's gonna be like nothing to you just go to work and you shut off your brain and you, like, do it all. And he's like, "You gotta find a specialty where you have time to do things outside of work." And I was just like, "Okay, ding, 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 I gotta not do surgery." Sorry to keep talking about surgery, but I did think very long and hard about it, as a
No,
med
I love
student.
that. No, and seriously, like, this is exactly what I know that there's somebody out there who needs to hear that exactly because they maybe had initially been very hot on the idea of surgery. They learned some new information and wanted to pivot, but it really, like, you even underwent an identity death at the time, right? That's what
Yeah,
you're describing. You had like a mini crisis. You're out on
it was
Instagram
not fun.
before Instagram was big, just kind of like asking people like, "Hey, I'm searching for like some help and a lifeline." Like, I totally understand that. There isn't one dark night of the soul that we experience over this many, many year, 1 to 2 decade journey that you and I are describing. There's like multiple dark nights of the soul, honestly. Maybe for some of us, we have more than others. But I think that the more that we talk about it and you share your example of that, it's very easy for people to see where you are at now. You're a chief resident at an incredible, so prestigious location in Radonk, which is so competitive. And people see you and they just think, oh, okay, like that could never be me. She's just been killing it the whole time. And,
No.
and she probably picked Radonk when she was 12 years old. That's what you have to do. Well, you didn't. You didn't pick Radonk at 12. It was not rainbows and butterflies the whole time. Anyone who tries to tell you that about a long career in medicine, they're not being truthful. They're not painting a whole picture. There are absolutely times of rainbows and butterflies, but I love how much you give like this three-dimensional look into a hardworking person who, when faced with like new information at a pretty formative time, mid training, made a big change. And so I just remind people of that when they see you out there killing it now.
Thanks. You're very nice, but I think like, you've done I think like the whole ethos of everything you're doing and you telling your stories and being very truthful and being very honest too, like the good, the bad, the ugly, and I think that's really important. And honestly, it really bothers me when people just gloss over everything like, "Oh, yes, I just soared to the top," or whatever. But I'm someone who loves digging into those hard movements because like really, throughout our entire careers, it's full of pivoting, right? But no one likes to talk about that or we kind of forget too, because it's just like, oh, that was a hard time. So I'm just going to erase that from my mind. And I think it's important to know that we make all these decisions at all these junctures in our training or whatever. And as attendings too, and it's never just one path. You kind of think it's just one path all the way through, but people like I've had friends who like medicine at all levels, like undergrad, I guess high school, that's way too
Mhm.
early. In residency, and all levels. And that's okay. It's not a failure, it's just you realizing something about yourself. And when things get hard, you should just kind of not like turn within. But you should do a lot of introspection, and then you should talk to a lot of your family members, your significant other, your friends and your family, kind of figure out like what do I want? And I think that's the hardest thing for a lot of people is like, what do I want? And like as like you say I'm a chief resident, but really it's just like I'm in my final year. And when when your program's really small, there's not a lot of people to select to be chiefs. Not that it's not an honor, I guess.
Yeah,
It's
no, it's
great
still
to be a
something.
leader. Yeah.
Um, I I love that. I would phrase what you're describing as look inward. Yeah, and I
Yes.
agreed. Not like turn inward and close up,
Yeah.
but agreed with looking inward, but like truthfully. And again, this is why I get it so much though, right? Like I 100% get it. I empathize with this because I will tell you the reason that I did not look inward for 10 years, right? Even when things were pretty bad externally and things felt bad internally and I just did not look inward. I didn't want to know. I did not want to find out what I really wanted because guess what? If I looked inward and I found out what I really wanted and it wasn't being an ENT surgeon,
Mhm.
then that is a load bearing issue. That would mean upending my whole life, which is quite literally what it meant. But I get the reticence. Like, I just didn't want to know for a long time. I totally buried my head in the sand, ignored a lot of cues for a long time. And so I understand why people do it. I will say that as unpleasant at times and as uncomfortable as it can be, it was definitely worth it. This is much better than the alternative, which is that I stay not knowing myself and not like letting myself admit what I really want or don't want. And then the last thing I want to mention really quickly, because you pointed out, absolutely most of us know people who left medicine at different career points. But here's what's really beautiful, right? Because I'm definitely not trying to not receive healthcare when I'm older or anything like that, right? This is not about like even the exodus from medicine. This is about pivoting. And so what I would augment your point with is just that beauty, that ability to say, I don't like this job. I want a different job. I want a different professional identity and career. It applies to everyone. And guess what? I know some of the most incredible physicians I know are non-trad, as in they were 28 years old working in finance when they said, I don't want to do this anymore. I actually feel called to go into medicine. And then they move into medicine, right? Or
And
they
then
do
those
it at
people are, like,
35.
super applauded for going to medicine as if it's, like, the holiest I don't know, I
Yes,
hate
which
the
I
word
don't agree with
calling.
that. Yeah, yeah, yeah. No, and I don't agree with that. But what I'm arguing is that it's neutral to positive
Mhm.
equally in all directions. It's a bi-directional type of right that we have to pivot. And so we're going to keep fighting for that.
Yeah, and I think, you're, like, sparking things in my brain. I think it's just, like, when I think about mentorship in medicine and, at every level, you're mentoring the people right before you, right? And it's tempting to be like, "You gotta follow my path. It's my way or the highway. I was treated this way, so I'm gonna do these actions." I call them bad habits or bad behavior because I don't think people are inherently bad, not to turn this into a
Oh, I love that.
superhero movie, but I think, when I see people kinda, like, act out or do something really inappropriate, I'm like, "Come on, like, I expected a little bit better than you even though you're, like, 20 years older than me." I just keep it in my mind and, I just, like I don't know how I react to it, but then I see others treating others badly by, either judging them or making fun of them or, like, in your case, like, people are, like, saying horrible things to you, but, I mean, really, they're just insecure, like, not to be blunt, but, like, they feel like there's some reason they need to lord over you or say, "I know better than you," and it's just like, "Why would anyone know me better than me?" You know? Like, I said I didn't wanna be in this, so I'm gonna take my talents elsewhere and be strong in that. And so, I think, like, culture in medicine is very difficult to change, and it does I mean, it's kinda grassrootsy, like, I don't know, like, that's a weird buzzword, but, like, I think it's just when you see, like, bad habits happening, just call it out and be like, "Hey, that's not cool." Like, "Hey, be nice." Like, you don't know what they're going through. I'm like, don't, like, curse at them. It's just, like, little nudges like that, and once you make it, like, kinda socially unacceptable, like, things will change.
Yes, I love that, and I'm so we're gonna have to honestly bring you back another time and do go on a deeper dive, but I totally agree, and I'm very excited to kind of continue these important conversations with you, especially as you move through your chief year, and then you'll be an attending soon, and it is true that attendings have the ability to set culture and kind of create precedent on their own terms a little bit more than others do, and just excited for what's to come.
Yeah, no, I'm very excited. No, we should chat more for sure. I'm excited.
Thank you for tuning in to this episode of Surgeon Interrupted. Follow me on TikTok and Instagram at FrancisMayMD, and check out our other shows and content at hippocratic-collective.com. If you enjoyed this episode, please rate, subscribe, and leave us a review. We're going to keep bringing these conversations that normalize the whole spectrum of medical education and career to your doorstep.